Hello friends, welcome to my channel Eye Academy. Today we are going to discuss a common ocular problem, that is lid twitching, which most of us have suffered at one or the other point of time. This is a very common condition of our eyes, also called as lid myoclonias, and you'll get an idea by looking at this video what a lid twitching or myoclonias actually means. You can see the lower lid is twitching, fasciculating, involuntary, there is no blinking. As mentioned, it's also called as lid myoclonias, and it usually involves one eye at a time. So it's very rare that it will happen at the same time in both eyes. And it involves mostly lower lids. As you have seen in the previous video, the lower lid was flapping around. It's a barely noticeable or troublesome condition depending on the intensity of the twitching, as well as depending on the area involved. And it usually goes away in a short period of time, that is, it vanishes off on its own. But the problematic thing is that it recurs again and again. So you might think that probably lid twitching got limited, but it may recur after maybe minutes, hours, or days. What's important to know is that what are the various risks, what are your chances of getting lid twitchings, so that if we know the risk, we can probably help in solving this lid twitching problem by reducing those risk factors. Usually, as you will see in the treatment of this lid twitching, it is self-limited, and all you have to do is cut down your risks. The first risk will be stress. Stress and lack of sleep can lead to lid twitching, and then there are certain beverages like caffeine intake or alcohol intake can induce lid twitchings, like smoking can induce lid twitchings. There are certain conditions which can cause lid twitching, like if we have a foreign body, or there is inflammation in eye, that can lead to, or there is hot weather, dryness of eyes, that can lead to lid twitching. And there are certain drugs which can cause lid twitchings, like drugs used in Parkinsonism. These are the major causes, but there are myriad of causes, to be frank enough. This lid twitching is sometimes labeled as idiopathic when we don't get to know the cause. But these are the most of the common risk factors. Now, coming to the treatment part, how we can treat, as I already told you, that's usually self-limit. All you have to do is to reduce your risk factor, so that it doesn't so that it gets limited on its own. Then this is important to reduce your stress and cut down your coffee, alcohol intake. Then there is an important thing, is lid massaging, which can help you, as we'll see in this figure. All you have to do is you have to roll your fingers from below upwards if it is involving the lower lid, or you have to roll your fingers for above downwards if it's involving the upper lid. This maneuver is to be repeated 10 to 20 times in a day to get rid of the lid twitchings. In case the lid twitching is persistent and it's very troublesome, you can use what is known as Botox therapy. Although not used for that commonly for lid twitching, but it's an option. It's commonly used in other disorders closely related to twitching, that is blepharospasm or hemifacial spasms. I hope you have enjoyed this video. Do press the like button and subscribe to my channel for newer interesting ophthalmological videos.